Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on Face the Facts, we are responding to another question that got sent to our inquiry, which is, can I explain the growing trend of preventative treatments in younger patients? So first of all, I will say I can't, but my best guess is that because of the boom of social media, people have had access to a lot more knowledge and what other people in the world in different age groups and cultures are doing. And so they are learning more about these things that maybe you needed to hear from a friend of a friend of a parent of an uncle of a friend of a cousin before. Now it's so much easier to find that information, and that includes figuring out what your friends are getting, but also what celebrities are getting. So I would say just access of information is probably one thing. The second one, which is something that I truly hate, is that there are probably just providers who are not saying no. And it drives me crazy when I see patients who've gone through that, because it's really also the provider's job to tell someone and educate them that they don't need to be doing some of these treatments. So going to that in terms of like my personal philosophy, and I can't speak for everyone at West End Plastic Surgery, but I think a lot of people agree with me here on this, is personally, I think a lot of the things that people do for preventative purposes are being done way too prematurely. In the sense that you don't really start experiencing these signs of aging until your 30s, and possibly even like mid to late 30s. So people who are getting stuff in their 20s, and that includes me, so I'm part of the problem, okay? But people who are getting stuff in their 20s are probably just getting stuff to, I don't know, maybe make themselves feel better, make themselves feel like they're doing something, but I don't know how much it's actually helping in terms of preventing any kind of long-term aging. There are a couple of caveats to that. So for example, if you have certain medical disorders, like some issues with your collagen, or if you have, you've had massive weight gains and weight loss that might change the quality of your skin, certain things like that might be a little bit of an exception, where we might have to troubleshoot and do a little bit of something just to help you tune up, because you're not like the normal person coming through. But typical healthy people, I really don't think they're going to be getting that much benefit from doing stuff in their 20s. And it's similar to like, if you're eating a healthy diet and taking good care of yourself generally in your body, everyone says like, don't take vitamins because it's basically just expensive urine. It's kind of the same thing here too, in my opinion, as I think you're just paying for expensive stuff that's not really going to do anything for you long-term, at least in my opinion. Again, my one exception to this is also taking care of your skin, because as the skin ages, it's very hard to reverse that. And so you start to pick up sun damage and other damage to your skin, environmental things like smoking, etc. Really honestly, as soon as you're a kid, but as you get more and more further along in your life, you're only going to be exposed to more and more of those things that can cause aging of your skin. So skincare is one place where I would say, yeah, you should maybe start looking at stuff in your 20s. But even then, I'm not talking about doing crazy stuff like peels and things right away, unless, again, you have some kind of other medical history with your skin stuff. Sunblock. Again, it's always a sunblock. That's all I have to say. So these are my very personal thoughts on the trend of preventative aging stuff in the younger population these days. I am not being endorsed or speaking for anyone else in this practice. It's just my personal opinion, so I just gonna put that out there. But hopefully you learned something, and now if you do plan to come to see me for anything, you probably have a better idea of what I'm gonna tell you, whether you're gonna get a yes or a no from me. So my name is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery. I hope you learned something today this week, and I will see you guys next time.